Welcome back, everyone, to Let's Talk Sarcoidosis. I'm your host, Dorothea Howard, and today this is a great show about oral health. Joining me in the studio, I have Edward K. Brown, Dr. Edward K. Brown Jr., and he's a prosthodontist.
Yes.
Welcome to the studio today.
Well, thank you for having me.
And I'm really excited because we never really talked about the importance of oral health. So you're here today to make sure that everybody knows what they need to do.
Definitely.
All right, so my first question for you is, what is teeth in a day? Like, can you explain what that means?
Yeah, I think it'll be a little easier if I tell you exactly what a prosthodontist does.
Okay.
And then that'll make
Okay.
teeth in a day a little bit
All right.
easier to understand. So what a prosthodontist does, we deal with the replacement of teeth. Okay. So we specialize in dentures, crowns, bridges, veneers, implants, cleft lip and cleft palate. I don't know if you've ever heard of Operation Smile, where you have the children that are born with a defect in their maxilla, which would be their top teeth, where we work with patients in getting them involved with the doctors, the surgeons that will be doing the surgery, and then the replacement of the teeth at that point. Also deal with patients that have been in bad car accidents where they remove part of their jaw. We work with the surgeons in getting them back to making them look normal again. Okay. And one of the last things that we do is oral maxillofacial prost. That has to deal with if you've had cancer or anything like that, and they have to remove portions of the roof of your mouth for you to be able to speak and for you to be able to function and talk and do all the things that you were doing before the cancer. We work with making a prosthesis, which is something fake that's in your mouth.
So it's important to be a team.
Definitely,
medical
definitely,
team.
definitely part of the healthcare team.
Right,
Definitely.
And so now then you can explain about this saying, teeth in a day.
Okay, teeth in a day is something that was coined maybe back in the early 2000s, where we would replace all of the teeth. We would extract all the teeth and then replace all the teeth in one day using a substructure or a foundation that was based on implants or on a denture completely. Now, this is a concept that we've been doing in dentistry for years and years and years, but has gained great appeal just because it's had a little bit more marketing. So in essence, what would happen is you have a person that needs to have all of their teeth replaced. They have teeth that are broken down, have caries, have decay, have periodontal disease, and there's just no hope. Anytime you think about building a house, you want to make sure you have a strong foundation. And sometimes it's better to just demolition the house and start with a new foundation.
Wow,
Yeah.
Okay. So what are the options to restore a single tooth or a few teeth?
Okay, I'm glad you asked that question. Now, if it's a single tooth, we have a few different options. In the past, we had two options, or actually three options. One was do nothing. One was to have a 3-unit bridge where we have to remove some of the tooth structure from the adjacent teeth or the teeth that are next to it and make a bridge with a fake tooth in the middle, which we call a pontic. And the third option would be a removable partial denture. And if you ask me, most of the people that have removable partial dentures for one tooth are kind of doing a disservice for themselves. To have something so bulky in your mouth just to replace one tooth is kind of tough.
Okay.
Yeah.
Now, for our audience who's out there listening, Dr. Brown, can you tell us a little bit about your educational background?
Definitely. I was born in Philadelphia, grew up in the Washington, D.C. area, actually went to boarding school in Pennsylvania when I was 15 years old, and continued on to LaSalle University in Philadelphia, where I played football and baseball. When I was at LaSalle, I reached a point in my life where baseball wasn't working out, and I decided, because I was a biology major, that it was time to really take it serious with the books. So during in between my sophomore and junior year, I decided that, you know what, this was my chance. I always wanted to be a doctor. How was I going to do it? So I applied to medical school and I applied to dental school. They tell you not to do that, but I did it.
Okay.
And during that time, I realized that dentistry was a beautiful career path that opened up to me. So I applied to 21 dental schools.
Wow, 21.
And only got into one dental school.
Okay.
And that dental school was Howard University. So I always thank Howard for giving me the opportunity and the chance to become a professional and live out my dreams. While I was at Howard, I had the opportunity to be involved in biomedical research and extracurricular activities such as the American Student Dental Association, the National Student Dental Association, and the Student National Dental Association. And that kind of sparked my interest into the specialty of prosthetics. While at Howard, I applied to Harvard University in Boston, Massachusetts, and gained acceptance into their prosthetic program, which is a specialty program.
Wow,
which
prestigious.
Is, it was Howard gave me the foundation to be able to go to these
Yes.
places. So it was definitely, I can say that Howard was the driving factor.
Right.
That being said, while at Harvard, my program director posed me with the option of staying a little longer and getting a PhD or an equivalent degree. And so I decided to take him up on his offer and attempt to get a doctorate of medical sciences in oral biology. At my time at Harvard, I realized that there are very few of us in these positions, and it's up to all of us, and we do have an obligation to try to make sure that the students that are coming behind us know that they can do it. And so I got involved in the Office of Multicultural Affairs, the Office of Diversity, Inclusion, and Community Practice, and was able to speak to students and tell them about what my path was like into dentistry, which was not generally a traditional path, but I was able to talk to them and tell them how I was all about sports. Right. And then when sports didn't work out, I was lucky enough that it wasn't late enough in my educational career, and I didn't mess up my grades bad enough in my educational career.
Which is very important.
Very, very important.
Right.
That I was able to turn things around and apply. And I applied to 21 schools, so I faced, defeat many, many times. And that's why I always say it goes back to Howard that really allowed me to really have that foundation.
Right, and I've heard they have a great dentistry school.
Oh, Howard has an
Yes,
amazing dental school, dental school.
And that brings me to my next question, because it seems as if you had a lot of mentoring along the way. And so can you explain how important that is for mentoring, mentoring other people and also people along the way that help mentor you? Yes,
I think that I'm a product of good mentors. Wholeheartedly. People that just took time in their lives to reach out and say, you know what, Eddie, I think you have what it takes I see some potential in you. Even though I may not have seen it myself, someone else saw it in me. And they gave me that confidence to be able to go out there and apply to a school like Howard and apply to a school like Harvard or to play baseball or to play football or any of those type of things. So some of the mentors are actually one of my business partners today. Is a mentor of mine. I was a student going into his office, and then I ended up joining the facility later on after I finished my education. And so, like I said before, I'm a product of good mentors, and I try to be a good mentor to any student that wants to know anything about dentistry. I have always an open ear for you to try to give you some advice about what kind of grades you need, how the process works. If your advisor's not giving you advice, you can come to me, and I'll definitely try to take some time out to show you how it was for me, even though it was a few years ago, but I'm sure a lot of the same tactics that I use are still valid right now.
So let's talk about sarcoidosis.
Yes.
And I know I mentioned we had talked off camera about it, but I want people to know, the viewers, because the majority of the viewers have sarcoidosis or know someone with sarcoidosis or a caretaker or just people that want to be educated about it. And I asked you a question, and I'm going to ask you again for the viewers to hear. I said, do they teach you about sarcoidosis in medical school? And you said
yes, they do. And I remember it in class because it's such an interesting name when you've never heard it before. You're like, how do you say it? How do you do it? What does it mean? And I think some of the biggest things that we learned in dental school was that we are going to have patients that have these diseases. So you have to have a general understanding of how to treat it. But the biggest thing is just knowing the link between our systemic health and our oral health and how we work in a healthcare team. So working with the endocrinologist, working with your primary care physician, understanding what treatment regimes you're on right now and how that's going to affect the work that we're going to be doing are some of the biggest things that I do when I treat a patient that has this, because not all patients have the same symptoms.
Right, and I actually meant to say dental school.
Yes, it's okay. A lot of times no, it's no problem. A lot of times we do the first couple of years together in school anyway. So
speaking of that, can you explain how you specifically treat patients with sarcoidosis?
Definitely. I think like I said before, it starts with that first phone call to their primary care physician to understand how severe are their symptoms. Are there symptoms of having, periodontally involved teeth, loose teeth that are just hopeless, that we need to think about some other options, that this tooth that has been loose for a while, it's just hopeless and we have to think about what we can do as far as a replacement? Or is this a situation where we can salvage the teeth through means of making sure that there's no bacterial insult and also making sure that their medications are not affecting the treatment in any detrimental way?
Okay, yeah, that's the other thing you
Yeah.
mentioned about medications. How can, and I know it may be difficult to answer, but because people do take medications, how can one prevent certain things from happening, with oral health?
Well, you brought up a very, very good point, and if I can just try to elaborate a little bit on that, I believe that a lot of medications that we take may prevent the amount of saliva that you produce, and saliva is anti-cariogenic in the sense that it prevents you from getting cavities.
Oh, wow.
Okay, so when you have a decreased saliva and in your mouth, you have a higher chance of having caries or any of the sequelae that comes with that. So that being said, what are some of the things that you can do? Understanding the medications that you're taking, coming up with a regime that not only satisfies what your primary care physician wants out of your health standards and your endocrinologist, but also your dentist. There are over-the-counter treatments that you can take, such as Biotin or Oasis, that cause you to have more saliva. Xerostomia is which is the lack of saliva, or dry mouth is what we call it in general terms, is something that's often overlooked by patients until they have it. It's not something you think about until you have it. And then what are my treatments for it? And those are some of the biggest things that we do. And it's just having an understanding, empowering my patients are some of the biggest things that I try to promote, is making sure that they understand that you have 100% stake in this, and you have 100% stake in how well this goes. So if we all are in there trying our best to try to use not only the standard of care, but also being not so much creative, but open-minded with the treatment regimes that we're looking at, I think we end up with much, much better results.
So can we talk about, by you being a prosthodontist,
Yes.
can we talk about what happens when people leave their illnesses or, gum diseases untreated?
Yes, definitely. A lot of the things that I deal with is just long-term neglect. A lot of my patients, and as I said before, because I deal with dentures, crowns, implants, and veneers, and things like that, I treat a much older population. I like to say my patients are the 55 and up crowd.
The baby boomers.
Yes. I like to say they're the sophisticated, mature crowd. You look a little too young to be in that crowd, but
I'm in there.
You're in there. Okay, we're gonna let that one go.
Yeah, we'll let that go.
Okay, but some of the things, just to answer your question, some of the things that we try to do for these patients that are in that population is just letting them know that you've taken care of people your whole entire life. You've taken care of your children. You've taken care of either your husband or your wife or your mother or a brother or something. Now it's your time. And what that means is that you deserve the right to have the ability to chew food properly. True. You deserve the ability to be able to have a nice smile and have your confidence into your golden years. So some of the things that I try to do is just let my patients know that for once it's about you. It's about you, and if that means that, you're going to have to remove all of these teeth that you've been holding on that you can't really chew with and that you're holding in your mouth. I have a patient that holds her teeth in her mouth with floss.
Really?
And I told her, this is just unacceptable.
Right.
You deserve better. Don't you want better?
Right.
These are the things that I try to, express to my patients and let them know that, and that all can be done at our office, We'll take you, and I work with the team. I work with oral surgeons. I work with periodontists. I work with general dentists. And I also work with psychiatrists, all aspects of your life. I want to make sure that you know that you have a dental home and that we can try to help you with the issues that you have that are dentally related. And if we can't help you with the issues that are dentally related, we're going to point you in the right direction so you can get your needs addressed.
And, speaking about that, do you think that it's primarily fear of why people put off and not get the work done? Because I would imagine that a lot of it is fear.
I talk to my staff about this all the time. Nobody likes coming to the dentist.
Right.
Nobody likes coming to the dentist.
Not even to get them clean.
Nobody likes coming to the dentist. There's going to be a certain level of discomfort that you are going to have to undergo getting to the dentist. And I think that's why we at our practice, we pride ourselves on trying to make it a great experience. When you walk through the door, somebody's going to ask you for your coat. Can we take your coat? How are you doing, Mrs. Smith? How are you doing, Mrs. Howard? Can we offer you any water? Would you like some coffee? We have one of my colleagues at the office. She's known for making some amazing cakes. So we always try to keep a cake in the office also.
Right.
So yes.
Okay.
Yeah. So.
Wow, that's good. So
yeah.
People that are watching, if you're fearing, going to the dentist, perhaps sometimes it's the actual service that you get at the practice that will make you feel a little bit at ease.
And also, just like with our conversation that we've had, I think that before I sit down, before I get into put my hands in anyone's mouth, I sit down and have a conversation with them. I think because I'm going to be, in your intimate space, yes. I want you to know that I want to know where you're from. I want to know what your interests are. I want to know why you're here. So then we can build a rapport that makes the whole experience a lot better.
Okay. Now let's talk about diseases again.
Yeah.
Other than sarcoidosis, can we talk a little bit more about what specific diseases causes oral health problems?
Yes. Now, a lot of people that have uncontrolled diabetes, okay, is a real tough one because when you have uncontrolled diabetes, you have poor wound healing. So that means you are at a higher chance of having loose teeth. You're at a higher chance of having periodontal disease. You're a higher chance of having inflammation of the gums, ultimately reducing the underlying bone around the teeth. So all of these things affect your treatment, and they affect what we can do for you as far as like your options. Right. So if I know somebody that has uncontrolled diabetes, the first thing I'm going to do is try to get them involved with their primary care physician so we can get that diabetes under control.
Right.
Now, if someone has hypertension, we want to make sure that, I take blood pressure at every initial appointment, and I try to take blood pressure at every appointment so I know exactly what's going on with my patients at that present time. So then I build a baseline of what's going on with my patient. Do they just normally run high? Have they not taken their meds today? And especially if we're doing any type of extensive procedures such as dental implants or removing your teeth or extractions and things of that nature.
So just out of curiosity, does those procedures take a long time? Because I'm sure that some people that are out there watching, maybe they may not want to have work done and leave it untreated because they feel like it takes 2 and 3 hours to have, and they're really afraid to come in just for 30 minutes.
Yeah, no, that's a very, very good question, and I think it has to do with our feelings and our what's the word I'm looking for? Our attitude towards dentistry. Now, if you go to a physician and the physician says, "Okay, you have a broken ankle. We can fix this. We can fix this ankle, but the surgery is going to be about 3 hours, and you're going to be in some discomfort afterwards, and you're going to have to take some pain meds, and it's going to be a process getting you back." You're like, "Okay, doc, I'm for it. Let's get it done." But when we come to the dentist, it's always like, "I don't want to do this. I don't want to do that," or there's a bit of resistance that tends to happen from time to time, and so I feel that at the initial appointment, building that rapport, building that relationship with the patient, telling them about yourself and your background and how you are just as involved in the case as them, makes them feel like, "You know what, doc, I think it's worth it." And I always want my patients to have informed consent. I want you to know what you're getting yourself into before you go ahead with it. Because a lot of times someone may say, "Hey, you have to have this dental implant. We'll be done in about 2 hours." You're like, "I didn't know I didn't know that you were gonna have to give me needles. I didn't know that I was gonna have to have an injection. I didn't know that there was gonna be an implant placed into my bone." Those things I want the patient to understand that. So we have schematics, videos, we'll talk you through it, we'll explain everything to you so that you know. And especially with the aid of computerized technology now with CAD/CAM dentistry and the different scannings, every patient that comes into my office that gets a dental implant is getting a cone beam CAT scan, or CBCT for short. So that way we understand exactly how much bone they have in the vertical direction, in the horizontal direction, and also the width. So when we plan our cases using digital dentistry, you'll be able to see that we know exactly where we want that implant to go. So we are ensuring that the success of our implant is well.
Okay. And speaking of baby boomers that we talked about prior, what type of patients, and I would say, what's the number one type of illnesses that you get from baby boomer patients with oral health?
I think the number one thing that I get, and then I see it often, and I really want everybody to take this into consideration. Okay, if you have a tooth that's giving you some pain, or that the doctor gives you the option of doing a root canal, taking the tooth out, or those are your two options, try to save every tooth. Try to save the tooth if you can, okay? Because what ends up happening is, like, in your early 20s, you lose a tooth right here. In your late 20s, you lose another tooth on the other side. In your 30s, you lose another tooth down here. In your late 30s, you lose another tooth on the other side. And then strategically, as you try to chew, you don't have opposing teeth to chew with. So you may have a nice smile in the front, but you don't have any teeth in the back. And one of the things that happens when you lose teeth in the back, from a cosmetic standpoint, for all my ladies and all of my gentlemen that want to look good into their golden years, as I like to call it, is that you start to lose facial height. So you start to look like that grandma that can flip her lip over her nose because you've lost your back teeth.
Wow.
So it's very, very important that we not only restore that, because the way the mouth works is that the front teeth protect the back teeth and the back teeth protect the front teeth. So once we move or lose any part of that system, you have a breakdown.
I never thought of it that way.
Yeah, took me a lot of time in school to be able to understand these concepts. So yeah.
So let me ask you this, when we
Yeah.
talked about the ages. Do you treat children, just out of curiosity?
Yes, but I usually treat children that have some type of congenital disease or there's a few diseases out there that I treat a lot of. One is dentinogenesis imperfecta, which is, it has to deal with the way the dentin develops as a child. It becomes softer so that teeth don't grow and develop as well. So we have options as putting crowns on the teeth, kitty crowns, and then we transition them into adult crowns later on, or composite crowns later on in their lives. Also, if they have a cleft lip or a cleft palate patient, I might make them some type of partial denture so that they can go to school and have the confidence to be able to, because kids are pretty rough on it themselves.
Unfortunately.
And if you don't have, if your
terrible.
teeth are a little out
Right.
of line, or if something's going on at a young age, it's very difficult. Or if you're just missing a tooth, maybe you were just born without a tooth. So from that standpoint, that's what I specialize in. And during my time when I was at Boston, I spent a little time at the Children's Hospital up there, and it became kind of a little niche for me to try to work with those patients because I really love prosthetics, removable or fixed. Yeah.
Let me ask you, do you happen to get a lot of patients that may have sleep apnea?
Yes.
And
yes.
let's talk about that, because I'm telling you, a lot of patients who have sarcoidosis, they also have sleep apnea.
Yes.
And I know that can affect your
Definitely.
teeth.
And I think it's also a very good idea to focus and make sure the dentist that you specifically go to knows something about sleep apnea. A lot of people say they do, but that has been trained in what type of device can be used for sleep apnea, the coordination between a sleep center, so you can know how many times during the night they have had these episodes. It's very, very, very important. Now, working with some of their specialists that give them CPAP machines or different versions of them now. In dentistry, in essence, what we are doing when we try to treat sleep apnea is we're using a mandibular repositioning device. So in essence, it positions your jaw forward to bring your soft palate down so that you can breathe and your airway stays open as you lie down. So as you position your jaw forward, you will see that your soft palate will come forward, also allowing air to flow from your nasal cavity down into your lungs. So.
Wow.
Yeah.
So what would you say to people that are watching, as far as, like you said, just a whole supportive team?
Yes.
And I know we talked a little bit more about it, but can you just elaborate a little bit more? Like, if people have, I have this physician I have to go to, I have to see this doctor, this dentist, what's the important factor that they should know as far as them actually being an advocate and taking care of themselves as well? What would you say to people like that?
Well, I think it all starts at the first visit. And you have to be attentive to the type of dentist that you have. Do you have a dentist that's just running through really quickly, giving you about 10 minutes of their time and say, okay, now time to get a cleaning, see you, we'll get these fillings done the next time? Or do you have someone that's gonna sit down and actually interview you? That's why we call it an interview. The very first appointment, you fill out a questionnaire and we go through it. Every single step of, I want to know about your medications. Are you taking them? Have they been updated? Who is your primary care physician? Do you have one? Then a bell goes off in my head. Okay, this person is a primary care physician. This person has an endocrinologist. This person has a cardiologist. This person has all these different. Now I have to coordinate with those different offices and making sure that the treatment that I propose is aligned with everything.
Okay.
So it's very, very important that, and I've been very fortunate in my career of practicing dentistry to be able to work with some excellent physicians that understand their limitations and understand their role in the whole team.
And so it's important as well for the patient
Yes.
to take a role
Yes.
in this team effort as well.
The patient has the
correct?
most important role.
Right.
Yes.
I mean, we just can't always rely on
I
the
think
medical
I think the days of just saying, okay, you're the doctor, whatever you say,
Yes.
those days are over.
Okay.
I think my patients are so educated. Everything I tell them, they go on Google and they bring me back. They bring me back articles. They bring me back, you know, things that they've written, videos that they've watched, just explaining. Well, this is not what you said, doc, or this is exactly what you said. Is this what you said? And then they say, you know what? You were on the right track. It's just a little off. This is what I meant, and this video explains this. And I try to inform my patients as much as possible. So that I think that once you have information, you become empowered. And I want all of my patients to feel empowered. I don't want them to feel like, Dr. Brown, this is your show, whatever you said goes. No, because if something doesn't go as we plan, I want you to know that, well, we talked about this before. We talked about that, you know, when you have this denture, it's not going to be as stable as if you had implants underneath the denture.
Wow.
Yeah.
Well, you know, believe it or not, this is the end of the show.
Oh, wow.
I mean, the information was so empowering for the audience, and I hope and pray that they got the information that they needed. And if they're fearful, to really talk to someone. If they're in the DMV area, they can check the credits after the show.
Yes, we're located in
yeah,
Chevy Chase.
in Chevy Chase, Maryland. It's Metro accessible.
We are Metro, actually on the DC side, so we're right by Friendship Heights.
Okay, so they can catch the Metro and don't have to worry about traffic. They can contact you.
Definitely, and we do have an Uber program for our patients.
There you go.
You know, we're trying to do things a little differently.
See, that's what you call service.
Yes. Well, that's the thing. I'm in the service business.
Right,
You know?
and that's important when you're in the service business and you really care about your patients. So, Dr. Brown, I would like to thank you so much for coming on the show. I have to also give a shout out to Dr. Hornby.
Yes.
Because he's the one that
coordinated.
You know,
all this.
he coordinated for you to be on the show today because he was unable to be on the show. So, you know, shout out to him.
Definitely. Dr. Hornby is an amazing doctor at the Maryland Center of Aesthetic Dentistry.
Yes,
really
yes,
great
and he's actually my dentist.
I didn't know that.
Yes.
Okay.
So thank you, Dr. Hornby, for you know, reaching out to your colleagues, and that's what it's all about. It's the networking and the support to make sure that we can all help viewers out there and to help save lives, really.
Definitely.
Because oral health is, you know, that's a life-saving problem.
You just have we just cannot separate our mouth from the rest of our body.
Right.
It's a part of our body.
Exactly.
So there's definitely a link between oral health and systemic health.
So keep that in mind, and once again, thank you so much for watching the show. I'm glad that you continue to tune in, and as I always say, stay positive. Do not let your illness define who you are, and blessings to you all. Thank you for watching, and thanks again, Dr. Brown.
Thank you. I really appreciate it.
Thank you.
All right.